Joshua Clinton. I'm 31. I do water sprinkler systems throughout Little Rock. I was in a car wreck. Busted out most of my teeth. I've had them repaired a couple, 2 or 3 times. Most people would think it was drug issues or drug-related problems, but it's not. Mine was mostly from car wreck and bad dental work. And figure I'd give it another shot and see what we can do. I don't too much smile. If I do, it's more of a grin than an actual show of my teeth. Used to have a lot of personal issues with it myself, but I've kind of grown used to it. And like I said, I don't hardly smile at all, so I try not to show it. I have 5 kids, so they ask me, Dad, what happened to your teeth? So I'm like, well, to try to make it a little easier for me to explain to them, I figured I'd just go ahead and see the dentist, see if I can get them took care of it.
When Josh arrived in the clinic, he had multiple teeth that needed a lot of restorations. A lot of them were deemed too far gone, so they needed to be extracted. The main ones in question were his front teeth, so to get him back into where he could have a smile, week of restoration that would be efficient for him, something quick, usable, and be long-term and lasting for him. So we decided to use what's known as a removable partial denture. Here's a sample of a removable partial. It's not a complete denture where all the teeth are lost, but you still have some of the teeth present, and then it clicks into place and it restores that arch to full function. In Josh's case, it wasn't the posterior or the back segment that we had the anteriors, the front teeth. Took cast or models of the teeth, we made impressions or molds. The clinical things we need before we started that restoration. We needed the x-rays, we needed the clinical exam of the remaining teeth we were keeping, and his general architecture of his ridge. First thing we use is we use some anesthetic. We have to numb the patient up, so this is what everybody's fearful of. It's a very tiny needle. It's a 30 gauge needle, and we have varying anesthetics that we can dispense through this syringe. So we use these, and certain landmarks in the mouth that we use, the roof of the mouth. There's certain spots that we use to anesthetize those areas, and the patient gets quite numb, and they really just feel pressure once they're properly anesthetized. So that's the first thing that we use. Second thing we use is, everybody uses the word pulling teeth. We don't really pull teeth. We move teeth, and we use certain instruments called elevators, which look like a little pry bar. They come in different shapes. Certain dentists like certain shapes. I happen to like certain ones that I do. I actually customize some of mine to get the actual end or tip of it that I like. So I literally adjust them and grind the instrument to the bevel and that I would want to do. It allows me to insert the instrument at an angle that works for me. So we have the teeth luxated or slightly moving. We use the dreaded forceps. There's different shaped forceps for different teeth. Certain teeth are designed to grip certain teeth because of the morphology or the shape of the teeth. This is one designed for a maxillary, either anterior or premolars. So we took out his front teeth, and this is one of the instruments that we use to take his teeth out, the front teeth out with. His partial was made out of basically 2 types of material. You have a metal framework partial, which is a chrome vanadium metal, which is very hard and durable and resists bending. And then the other one is the acrylic, or the methyl methacrylate. The teeth themselves are made out of the same material as the pink. They're just more reinforced to stand up to the wear of biting of the teeth, but they're still basically the same methyl methacrylate that's been around for a long time. Methyl methacrylate acrylic, not unlike the acrylic that ladies get put on their fingernails. It's an acrylic type. It's the same type of material, and then the metal framework itself is a chrome vanadium alloy. Procedures that we did today on Josh, it's, sometimes we always have to talk about the dreaded issue of money. And in Josh's case, though it varies from dentist to dentist, there's ballpark figures, and usually in regional areas there's cost. So that cost, today we removed 7 teeth. Those teeth are roughly, can vary between $175 to $250 or a little bit more. depending upon the difficulty and of what it takes to take those teeth out. Partial framework that was given, or the framework that was done for Josh, that's in the ballpark of about $1,800. You're looking at $3,200 worth of services probably. The length of the surgery could vary between, again, it took us 10 minutes worth of extractions. That could vary if there was a complication, if a tooth fractured and we had to go remove the root tip that was in there. Today we didn't have that happen. If there were bony prominences that are present sometime and they needed to be removed, that increases the length of surgery. If sutures are needed, again, sutures weren't even needed today because we didn't break the tissue and make a tissue flap, so we didn't even have to suture him today. All of those would add little time. So in a typical procedure, we had to get him in a chair, get him comfortable. We placed nitrous oxide on him. We anesthetized him with the dreaded needle, and we had to let that medicine work. So it was 35, 40 minutes tops. How much pain am I going to be in after I have multiple teeth extracted? That's a question that gets asked all the time. The answer to that question is a lot less than what you would think. Most of these people that have this procedure done have had multiple abscess teeth along the way, and they've probably been in an excruciating amount of pain due to the abscesses they have. When the teeth are removed, that particular type pain is gone. Usually they have been through the worst of it by the time they've just had their abscesses and their other things. When we take the teeth out, it's usually a relief for a lot of them, so the discomfort's mild at best. I believe today we extracted 7 teeth, and the key teeth for him, which we extracted, were these front 4 teeth here. Once the teeth are removed, we evaluate the extraction sites to see if any bony prominences or any other things need to be taken care of before we try to fit in the prosthesis. What we did in Josh's case, however, was we tried to get his teeth to him as quick as we could, and so we did an immediate partial, which means that tissue will continue to shrink down where the teeth were extracted, and we will modify in time the underneath surface of that parcel to fit his tissue in those healed positions. So a couple of different ways to do it. Patients kind of drive sometimes how we want to do it because they want their front teeth, and that's what we were able to give him today.
Tell us a little bit about how you feel.
Awesome. Awesome. I get a lot more compliments. I can actually smile instead of closed mouth smile. Feel good about it. My boy loves them. I can take him out at nighttime and he's right there watching me, wanting to look and everything else. So it's pretty amazing. Kids love it. All my friends are like, my boss man still, he trips out over it every day. I catch him looking at me, it's like, what are you doing? I just can't get used to it. I'm still trying to get used to all of it. It's awesome. I feel more confident, and like I said, I'm not any part worried about smiling anymore. It's just smile and wave instead of closed mouth smile. I feel more confident about stuff, and I actually talk to our customers now when I'm at work instead of just kind of hang out in the back. I don't know how to explain it. It is crazy. I just knew that the outcome was going to be worth it. So after the first 2 days, it was fine. It really wasn't that bad. But trying to wear the parcel at the same time, it kind of made it a lot of pressure. After getting them adjusted a time or two, it was fine. Like I said, I've gotten used to them. I come in for my last adjustment last week, and I haven't had a problem with them since. So it's not as painful now trying to eat now that I'm healed up and everything. But it's still, when I have them out, still some getting used to with not having them there. And I talk like an old person when I have them. Before I stayed stopped up, I had problems with my sinuses most of the time, headaches. And I think it was more to do with the back wisdom teeth because that's the ones I've had most of the problem with. But like I said, I feel a lot different physically and mentally.